Hello, my name is Ian West. I'm going to be doing the healthy pregnancy video for BSN 346. To start, let's discuss your appointment schedule. You'll have monthly visits from your first month starting at 4 weeks or whenever you find out you're pregnant up until 28 weeks. From 28 weeks to 36 weeks, you will transition to a bi-weekly appointment schedule, and from 36 weeks until your delivery, you will have weekly appointments. At every single visit from here on out, we will perform 3 routine checks, measuring your blood pressure, check your weight, and have you provide a urine sample for your analysis. Your initial appointment is highly in-depth. We will be reviewing your family medical history, your previous pregnancies, if you have had any, and any surgical histories, identifying risk factors, review your medications, and calculate your estimated due date. At this first visit, we will also perform a pelvic exam, a pap smear, baseline blood draws, and an initial ultrasound, which may be transvaginal or abdominal, depending on how far along you are. Um, Throughout your trimesters, we will schedule specific diagnostic procedures and laboratory tests. For your first trimester baseline labs, we will draw blood to test your CBC, HCG, your blood type, your RH factor, and screen for HIV. We will also discuss optional genetic screenings. These include 3 blood tests, the NIPT and quad test for Down syndrome, and AFP for neural tube defects, as well as 2 invasive options um, to check for abnormalities of aminocentesis and sorry, chorionic villus sampling, or CVS. Huh. Trimester milestones starting at 10 weeks, we will use a fetal Doppler to listen to the baby's heartbeat and begin measuring your fundal height to ensure proper growth. At 20 weeks, you will have your fetal anatomy ultrasound scan, which is typically when you can find out when the baby's gender. Second trimester, 24 to 28 weeks, you will complete a 1-hour glucose tolerance test to screen for gestational diabetes. At 28 weeks, we encourage the Tdap vaccine. If you are an Rh negative mother, you will receive a RhoGAM injection. Um, Third trimester, 36 weeks to delivery, we perform a Group B strep vaginal rectal swab during these weekly visits. We will also assess the baby's position, check your cervix, and educate you on the true versus false labor contractions, warning signs, and what to do if your water breaks. Proper nutrition is vital. We recommend increasing your intake by about 300 calories per day, depending on your pre-pregnancy weight, utilizing a well-rounded diet. The food groups include things like eating vegetables for potassium and vitamin A, fruits for potassium and vitamin C, dairy for potassium, calcium, and vitamin A and D, grains for iron and folic acid, and healthy proteins like beans, nuts, and meats. Huh. Safety and fluids. Always thoroughly wash your fruits and vegetables. Ensure all meats and proteins are fully cooked to prevent foodborne illness, and drink 8 to 10 glasses of water daily. Supplements, we strongly encourage taking a daily prenatal vitamin. Specifically, you need to take about 600 micrograms of folic acid daily to lower the risk of neural tube defects. You should also look for supplements containing omega-3 fatty acids for fetal brain development, iron to prevent the anemia, and calcium and vitamin D for bone health. For physical activity, stick to low impact exercises. Excellent options include things like walking, yoga, swimming, stretching, and Pilates. You should aim for about 2.5 hours of exercise per week, which can easily be split up over multiple days. To keep you to keep you and your baby safe, completely avoid things like contact sports, heavy weightlifting, certain abdominal exercises, or activities with a high fall risk. So no CrossFit, like my wife did. Your healthy gestational weight gain is determined by your pre-pregnancy BMI. If you are underweight with a BMI under 18 and a half, you should gain about 28 to 40 pounds. If you're in a normal weight with a BMI between 18.5 and 24.9, you should gain 25 to 35 pounds. If you're overweight with a BMI of 25 to 29.9, you should gain about 15 to 25 pounds. If you're obese with a BMI of 30 or or higher greater, you should gain anywhere from 11 to 20 pounds. Um, Things that are common complaints during pregnancy, nausea and vomiting. Keep a healthy snacks on hand. Eat small, frequent meals throughout the day so that your stomach is never empty. Avoid spicy foods and try ginger tablets to alleviate some symptoms. Stretch marks. Apply a pregnancy approved lotion combined with vitamin E oil over your breasts, your abdomen, the upper legs, and um, both during and after your pregnancy. For constipation, relieve this by increasing your daily fluid and fiber intake and maintaining adequate light exercise. Taking a stool softener, if approved by your physician, can also help. Finally, you must seek immediate medical attention or go to the emergency room if you experience any of these three critical warning signs: leg pain, redness, swelling, or localized heat. This indicates a potential deep vein thrombosis or DVT. If you have a severe persistent headache, this is a key warning sign of preeclampsia, which is extremely high blood pressure during pregnancy. And severe abdominal pain, this can indicate a placental abruption, which is a dangerous condition where the placenta separates from the uterus. Um, Thank you for watching my video.